This video is about super important topic, that is high alert medications. And high alert medications are commonly tested in the board exams. And here first, let's see what exactly high alert medications are. The high alert medications are the drugs that can cause serious harm if they are used in error or by wrongly. So that means this medication, if it is used wrongly or in by mistake, and that can result into potentially harm or it can be fatal. So those list of drugs are considered as high alert medications. Well, there are two important organizations. They made those list of drugs that is considered as a high alert medications. One is the Institute for Safe Medication Practices, in short ISMP, and then the Joint Commission, or in short JC. So today I'll be discussing about those two organizations and the list of those medication that is considered as high alert medications, and then potential harm that can cause by them, and also what are those recommendations from ISMP to minimize those errors. Well, then also I would be discussing about Joint Commission, the recommendations as well. And after those summaries on those medications list and potential harm and mitigation strategies, and then after that we'll be discussing questions and answers, which is simulated as PTCB mock exam style questions and answers. So let's start. High alert medications from the ISMP provides in the three settings. One is acute care settings, which is in hospitals settings, and then community and ambulatory healthcare settings, and then long-term care settings. So I'll be going through each of them, and then I'll be discussing what are those list of drugs that is included into the high alert medication class, and then what are those potential harms. So let's start off with acute care settings, which is of first drug here in this class of drug that are known to cause harm if it is mistakenly used in hospitals. If the important one is start with insulin. All types of insulins are considered as high alert medications. So, well, this high alert medication, if it is wrong dose or wrong person or wrong dosage forms are used, that can result into serious harm. Immediately, it can result into suddenly low blood glucose, which is known as severe hypoglycemia, and that can result into coma and fatality. So, therefore, insulin is one of the most commonly known for its high alert medication list of drug in acute care settings. So ISMP recommends how to minimize those errors in hospitals. So across the all settings, it is recommended to use standardized insulin protocols. Make a standard procedure for prescribing standards, plus also dispensing and counseling standards for insulin that helps to minimize them. And especially insulin that comes with the U500, that means there are 500 units of insulin, which is a high concentration insulin, which can be considered as 1 milliliter has a 500 units of insulin, which is considered a high concentration, can result into serious harm. So therefore, all these insulins, SMP recommends that double checking before you dispense and before you use them or administer it. Those are highly recommended for a recommendation from the ISMP to minimize the risk of insulin errors that can result into serious harm. However, these high alert medications are not a dangerous medications. However, if it is used wrongly, then it can cause serious harm. So next, other important class of medication in acute care setting is about anticoagulants that include warfarin, heparin. If it is used wrongly or in either high dosages or combined with the two anticoagulants, can result into serious bleeding, or it can cause hemorrhagic bleeding and can be causing serious harm. So therefore, ISMP recommends standardized dosing procedures and also labs monitoring the lab test, like for example, warfarin monitored by INR and heparin is monitored by APTTs. Those labs helps to prevent, even before bleeding happens, it can be prevented by using these lab tests. So, and also it is very important to have a patient education about this anticoagulants use. That means patients should be aware of those symptoms to monitor any risk of bleeding or bleeding symptom should be reported immediately to prevent the more serious harm that could be caused by these medication incidents. Next, other drugs in this category are chemotherapeutic agents. Chemotherapeutic agents are widely used in hospitals and acute care settings, which is the anti-cancer drugs. That helps in cure for cancer. However, if it is used incorrectly, that can result into serious toxicities such as bone marrow suppression or can cause various organ toxicities. Depends on the chemotherapeutic agents. So therefore, across hospitals, it is specific protocols of chemotherapy use is recommended, and also the healthcare professional administering or preparing or reconstituting chemotherapies have to follow personal protective equipment to prevent the exposure of these drugs to them, so that way it can hurt the operators as well. So therefore, and also before dispensing and before using, there's a multiple verification checks are made in the hospitals to prevent any chemotherapeutic agents mistakes, and that can cause serious harm. Next, other categories or goes on with the opiates. All dosage form of opiates. Opiates are used for severe pain in hospitals. It is used in IV form or oral or transdermal patches. In all cases, opioid overdose can result into respiratory depression, and that can cause death. So therefore, it is always recommended to use lowest effective dose of opiates and also monitor respiratory symptoms to minimize the risk of having opiate overdose, and also have those and the antidote of opioid overdose naloxone available in case of any kind of overdose situation that can be reversed by using naloxone, which is the antidote of opiates. Next comes to the another serious agent that is a very dangerous one, that is called neuromuscular blocking agent. This error can result into complete paralysis. It can be extremely dangerous drug. So therefore, it can also cause respiratory arrest. Well, it required labeling on them as a high alert drug in various acute care settings and also it should not be available easily on the floors or it have to be restricted access, and also before administering it requires several independent double checks that helps to minimize the risks. So these are some of the examples of high alert medications that are potential harm and the recommendations in acute care setting. Next, here we are heading into long-term care. High alert medications, harms, and recommendations are most of them are similar class of drugs. Also, however, there's a difference in the long-term care. Most patients who are in the long-term care, they may be taking several medications, and therefore there is a huge potential risk of drug interactions and also various other potential harm if it is used wrongly. So let's say first class of drug here is anticoagulants. If like the same risk is involved here, that can result in severe bleeding or hemorrhagic stroke can happen. If it is, that can be, and also same a standardized protocol have to be used. And of course, it is very important to have a patient education here. Patient education plays a very important role, and the labs have to monitor regularly to prevent any risk of severe bleeding, which is for warfarin, you monitor INR, and then heparin, you monitor the APTTs. Next is the insulin. All dosage forms of insulin, we discussed that previously in acute care setting. This also can result into severe hypoglycemia, and then also it can cause insulin. So therefore, ISMP recommends use insulin order sets and label clearly if it is a U100, or the prescribers have to specify exactly a U200 or U300. And therefore, pharmacists and pharmacy technician, it is extremely important to double check the dosages before you start preparing them, and have them clear instruction for technician to prepare these insulin preparations. Next, other drugs in the long-term care, or as we discussed, long-term care patient could be taking several chronic therapies, among them oral hypoglycemics such as sulfonylureas. They often can result into severe hypoglycemia, especially in elderly, because elderly will have more severe hypoglycemia than other age group because of a significant slowdown in the renal function, hepatic metabolism, and several other factors results into more hypoglycemia in that age group compared to other age group. And they have to be monitor blood sugar levels, and also patient education plays extremely important role in this case. And then also all dosage form of opiates use the lowest effective dose. If that pain can be managed by non-opioid medication, choose those options, or also monitor sedation and avoid duplication. Means patient could be getting opioid prescription from the two different prescribers. So therefore, that can result into overdose of opiates. So therefore, that require severe precautions to prevent any potential harm that could cause by these drugs. Next, other drug which is not there in the previous acute care setting, that is a methotrexate. Methotrexate oral or for non-oncologic use. Generally, methotrexate non-oncologic use is used for rheumatoid arthritis. It has several evidence-based reports that it causes fatal toxicity by the dosing errors. So methotrexate dose for rheumatoid arthritis is used once a week, mean one day in a week. And however, there have been errors of reports that patients have mistakenly given daily dosing. Therefore, that has caused severe fatal toxicities. So, to avoid that, it is very important to give a clear instruction to the patient about using this once a week, and also healthcare administration administers, they require more education on those use of this drug as a once weekly only. So there is no once daily dosing for methotrexate, if you especially if you are using for rheumatoid arthritis. All right, now we have other settings, that is community healthcare settings, community pharmacy settings. There have been reports of several medications, such as same medications, such as anticoagulants across all these three settings, such as acute care, long term care, and community based. Anticoagulants have been a big list of drugs as a high alert medications, so which can eventually results into severe bleeding, stroke. So require here, since it's a community based, patient will be taking their own medication. It is a very important responsibility of educating patient about monitoring those bleeding symptoms and reporting to the healthcare professional immediately if they experience any bleeding symptoms. And also insulin across three settings have been found to cause errors and can be fatal. Therefore, standardizing insulin prescribing and labeling concentration clearly and also double checking the dosages makes a huge difference, big difference in preventing harm. So, those are the very commonly tested questions in the board exams about this insulin, anticoagulants that include what are the potential harms and also what kind of strategies are required, recommended by ISMP to minimize those errors. Same thing again here, opiates, all routes of administration, which try give the lowest possible dose and monitor and provide naloxone when appropriate for the patient to minimize to in case of overdose that can help to reverse the opiate overdose effect of respiratory depression and can save their lives. So therefore, then other one, oral methotrexate in community pharmacy have been several reports of using daily dose instead of once a weekly. Remember, oral methotrexate is always given once a week. That's a key takeaway for the exams. Most examiners they like to test you questions on methotrexate dosing and the same way as opiate and insulin and anticoagulants. Then comes to the sulfonylureas such as glyburide is known to have a severe hypoglycemia that is also across all the settings, especially in community and long-term care where patients take lots of chronic therapies. So these are the list of drugs and their potential harm and ISMP, and these are the key takeaway points are anticoagulants, insulins, opiates, methotrexate, and hypoglycemic agents are known for very huge. And additionally, there are more such as epinephrine, vasoconstrictors, etc. in acute care setting. I'll be discussing them along with the questions and answers. Well, the next one is about the other organization, Joint Commission have made list of 5 medication classes that is known to cause harm and also safety recommendations. So, anticoagulants and also opiates and insulin and also benzodiazepines here additionally. And then, of course, chemotherapeutic agents. Those across have the similar recommendations from the Joint Commission as um, that is found in the ISMP recommendation. However, I like to add if you're prescribing a morphine sulfate, avoid using MS abbreviation or avoid MS using MSO4 abbreviation. Instead, for morphine sulfate, write the complete in the prescribing called morphine sulfate. So that helps to minimize the error according to the JC's recommendations. All right, so with these recommendations, now we are all set to start the questions and answers that are tested. And so before I go to that, I like to also add here some key takeaways. There are a few more high alert medication which I will be adding through these questions and answers. So let's start the questions and answers for mock exam. Here is the question: which of the following is the best describes a high alert medication? A. Drug with narrow therapeutic index. B. Drug with toxic side effects. C. Drug with higher risk of patient harm if used in error. And D. A drug with short expiration date. Well, the best answer here is I will give you a few seconds pause here. Just guess your answers. The best answer is B. C. Sorry. The drug with higher risk of patient harm if used in the error. Because the high alert medication is not necessarily the dangerous medications. However, if it is given wrongly, they cause severe harm to the patient. So that's the reason why the best answer here is C. Next, which of the following medication is considered as a high alert in community setting, like community pharmacy setting according to ISMP? A. Lisinopril. B. Metformin. C. Phenytoin. D. Hydrochlorothiazide. What is the right answer here? In community setting, the high alert medication include phenytoin. Phenytoin is one of the anti-seizure medication or anti-epileptic medication that is considered as high alert medication in the community setting. So, therefore, I like to add to that that also include other medications that is considered as high alert medication or include. Here we have additional drugs that is in the community pharmacy setting that is considered as a high alert drug, especially carbamazepine, lamotrigine, methotrexate, phenytoin, and valproic acids. And also, there are a few more specific drugs such as immunosuppressants, azathioprine, cyclosporin, tacrolimus, and also medication that are contraindicated during pregnancy, that is isotretinoin, also part of these high alert medication in community and ambulatory care settings. Next, a patient receives methotrexate with instruction to take it daily. What you should do: A. Dispense as written. B. Alert pharmacist to verify. C. Increase the dose. D. Add another medication. The correct answer is alert pharmacist to verify, because methotrexate should not be used daily in community setting for non-oncologic use. So therefore, it is important to alert pharmacist to verify this prescription. Next, why is an oral antidiabetic drug glyburide considered as a high alert medication? A. It has dangerous side effect. It causes insomnia. C. It may cause severe hypoglycemia. And D. It is used rarely. The correct answer is C. It may cause severe hypoglycemia, because all sulfonylureas, among them glyburide, is known to have high hypoglycemia side effect, and that can become more severe hypoglycemia if it is used along with insulin and other hypoglycemic drug. Glyburide has a long half-life, therefore it causes the prolonged hypoglycemic effect, especially in the older adults. Which of the following drugs should not be used during pregnancy due to teratogenic risk? A. Isotretinoin. B. Amoxicillin. C. Brufen. And D. Cetirizine. Here is the correct answer is isotretinoin. Isotretinoin has huge risk of teratogenicity in pregnancy. That means it can be causing severe harm to the fetal and also newborn. So therefore, this medication should avoid or completely not used in pregnancy. That's the reason, according to the FDA recommendation, there is a program called I-Pledge program. In that, according to that program, have to be followed before dispensing this medication. That means it require a pregnancy test, and also using following contraception during use of this medication is a mandatory requirement to minimize the risk of teratogenicity in pregnancy. Next, what is the recommended labeling practice for high alert medication before releasing to patient care areas in acute care? A. No label needed. Use warning label high alert medication. C. Handwritten direction only. D. Store in unlabeled bottles. The correct answer is whenever you're storing these high alert medications in the acute care settings, they have to be labeled on those containers to minimize the risk of um, wrongly using this medication. So that way, this warning labels alert staff and patient about special precautions for those medications, especially for neuromuscular blocking agent, which can be causing severe paralysis. Next, which insulin formulation is high alert due to its concentrated strength? A. Humulin R, B. Humulin N, C. Insulin U500, and D. Insulin degludec. Correct answer is insulin U500. All insulins are high alert. However, insulin U500 has a 5 times higher concentration to the U100, therefore require careful dosing to prevent the risk of overdose. Next, what medication is high alert antithrombotic agent used in community setting? A. Aspirin, B. Rivaroxaban, C. Clopidogrel, and D. Acetaminophen. The correct answer is rivaroxaban, which is an oral anticoagulant in community setting, which is known to cause high alert medication. In wrong using of this medication result into severe bleeding risk. Which of the following is appropriate error reduction strategy of high alerts meds, vincristine versus vinblastine? A. Color code storage bins. B. Group with OTC drugs. C. Use Tallman lettering. D. Skip the labeling. The correct answer is use Tallman lettering because Tallman lettering can help to differentiate look-alike drug or LASA drugs. Vincristine and vinblastine, they are sound-alike drugs, look-alike drugs, so that can be differentiated by using Tallman lettering. Which action is the most effective in preventing wrong patient error in acute care? A. Patient room number. Verify patient using two identifiers. C. Check patient chart only. D. Rely on wristband color. Correct answer is verifying patient using two identifiers helps to minimize the preventing wrong patient errors in acute care setting, such as two identifier name, first or last name, and date of birth reduces the wrong patient administration errors. Which of the following minimizes the medication error during transition of care? Like transition of care from acute care to hospital wards to the emergency wards, like those switching from those within the hospitals, transition can cause medication errors. So option here is electronic prescriptions, B. Barcode of the drugs, C. Medication reconciliation, D. Pre-printed medication list. The correct answer is medication reconciliation. Medication reconciliation ensures consistency and accuracy as patients move between different settings of the hospitals. So, medication reconciliation is a gathering patient medication information during transition from ward to the intensive care unit or ICU units or the other critical care units. Which of the following is a high alert opioid used in outpatient care? A. Naproxen, B. Acetaminophen, C. Fentanyl patch, D. Brufen. Correct answer is fentanyl patch. Fentanyl patch carries a high risk of overdose, require proper use and disposal, and this is commonly used in outpatient care. A patient with bipolar disorder is prescribed carbamazepine. What should the technician verify? A. It's stored at room temperature. B. Used for asthma. C, not to be confused with oxcarbazepine, and D, administered intravenously. Carbamazepine and oxcarbazepine, they are can be confused due to the similar names. So therefore, it is important to clarify before preparing this prescription. Next, which of the following medication types specially require the use of personal protective equipment during handling to prevent exposure risk? A, all high alert medication in all settings. B, chemotherapy, drugs. C, high alert medication acute care setting. D, high alert medication in long term care setting. Correct answer is chemotherapy drugs has the exposure risk. Therefore, during handling, to prevent that exposure risk, it is important to use personal protective equipments or PPEs. Which oral drug is used for non oncology purposes is high alert in long term care due to wrong dosing frequency errors? Correct answer is methotrexate. Methotrexate has been several reports of due to the daily use, mistakenly using daily instead of weekly, resulted in serious harm and toxicity of methotrexate. Next, which of the following medication is both a chemotherapy agent and high alert medication? A, rituximab. B, cyclophosphamide. C, warfarin. D, valproic acid. The correct answer is cyclophosphamide. Cyclophosphamide is a chemotherapeutic drug also known to have high alert class of medication. Next, a long-term care resident is prescribed concentrated oral morphine solution. The pharmacist confirms the correct dose and frequency. What is primary risk if this medication is administered incorrectly? A, paralysis. B, severe hypoglycemia. C, respiratory depression. D, major bleeding. The correct answer is opioid overdose can cause severe respiratory depression, so therefore, and also can cause fatal toxicities. So that means if dose is wrong, it especially overdose or combining two opioids can result into serious overdose risk. Next, which of the following is a high alert neuromuscular blocking agent? A, midazolam. B, succinylcholine. C, diltiazem. D, morphine. The correct answer is succinylcholine. Succinylcholine can cause respiratory paralysis if it is not used with ventilator support. So that is considered as a very high risk in acute care setting and can be dangerous. What is the main concern with IV vasopressin in acute care setting? A, sedation. B, bleeding. C, severe vasoconstriction and ischemia. And D, cough. The correct answer is severe vasoconstriction and ischemia caused by vasopressins. Vasopressins are one of the class of drugs that are considered as a high alert medication in acute care settings. So here are the examples of other drugs in acute care settings, which is not mentioned previous slides. So here you have epinephrine, also epoprostenol, magnesium sulfate, nitroprusside sodium, opium tincture, oxytocin IV, potassium chloride for injection concentrate, potassium phosphate, promethazine injection, vasopressin, and additionally there are other drugs which we already have discussed, plus also dextrose hypertonic 20% or greater, and chemotherapeutic agent and dialysis solution for peritoneal hemodialysis. These are the list of drugs considered as high alert medications in acute care settings. Next, A patient receives midazolam for moderate sedation. What should be monitored? A. Pain levels. B. Blood glucose. C. Respiratory rate and sedation levels. And D. Urine output. The correct answer is respiratory rate and sedation levels because benzodiazepine can be causing severe respiratory depression and also severe sedation that can be lead to the fatal overdoses. Next, which class of medication in the long-term care setting require monitoring for INR values, which is a lab for INR? A. Apixaban, B. Warfarin, C. Heparin, and D. Enoxaparin. Here in the option, all of them are anticoagulants, but only one anticoagulant is monitored by using INR. The correct answer is warfarin. Warfarin is only monitored by using INR, whereas heparin, APTT, enoxaparin, which is called low molecular weight heparin, which is also monitored by using APTT. Whereas INR is a lab for warfarin to make sure has no risk of bleeding. Next, which of the following is a high alert IV antiarrhythmic drugs in acute care setting? A. Propranolol, B. Amiodarone, C. Nifedipine, D. Nitroglycerin. The correct answer is amiodarone. Amiodarone is an IV and also comes in community pharmacy as an oral, which is used for arrhythmias, can be serious, toxic, or dangerous if can cause cardiac effects, therefore require monitoring if it is wrongly used. Next, if a patient is ICU is prescribed IV magnesium sulfate, what is key safety concern? A. Dry mouth. B. Severe sedation. C. Respiratory depression and cardiac arrest. D. Elevated blood glucose or sugar. The correct answer is IV magnesium sulfate can cause severe respiratory depression and cardiac arrest. So, therefore, that's considered as a high alert medication in acute care setting. Next, which of the following IV medication is used for sedation is a high alert? A. Propofol, B. Naloxone, C. Furosemide, D. Metoclopramide. Correct answer is propofol. Propofol is used in the ICU sedative, which require continuous monitoring for respiratory depression. Next, which of the parenteral solution high alert due to risk of hypernatremia? Dextrose 5% in water, 0.9% sodium chloride, C. Sterile water, D. Hypertonic sodium chloride, which is more than 0.95%. Hypertonic sodium chloride is considered as risk of hypernatremia, so therefore that require serious monitoring or precautions recommended by the ISMP because it can be dangerous and can cause serious complication. All right, with these questions, stay tuned for more videos and also subscribe Pharmacy Prep channel. Until then, thank you. See you again.